If you're suffering with chronic back pain, it's time to do something about it. The Bonati Spine Institute is world-renowned for its state-of-the-art procedures. Their slogan is, Bonati succeeds where others fail. Dr. Alfred Bonati is here to tell us more about it. Good to have you here.
Thank you.
A lot of people need spine surgery. A lot of people are afraid of spine surgery. Your procedure is different. It's not open back surgery. Tell us how you can do it not so invasively.
Well, it's a transfers of arthroscopic surgery. So we use an incision that's the size of my thumbnail.
Wow.
And we dilate the tissues of the skin by placing small tubes that they dilate slowly in the skin. And the elasticity of the skin allows us to see a very small incision. Now, once we are inside, the tubes can move in a circumference, so allow the big field to perform the procedure. But it's target. If you have a pain in the 4-5 level, we target the fifth nerve. So because it's a target procedure, we only can do one procedure at a time. And at the same time, we can remove the problem in that specific area. So we need to diagnose the patient right. We need to know exactly where we need to treat and what we need to do. And
are you actually speaking with the patient while you're working on them sometimes?
Yes. The initial part of the surgery, that is probably the tender part of the surgery, because it's not pain, but it's tender.
Right.
Is when we do the incision and we put the tubes. After we put the tubes, the patient is very comfortable. So we put the patient in a twilight zone, a little bit sleepy, when we put the tubes. And after we put the tubes, we open the thing. Underneath that area is no pain. So we can perform the surgery under visualization on the scope, through the scope, and discussing with the patient the problems.
Now, I understand you treat a whole lot of different symptoms, right? I mean, people who have carpal tunnel, whiplash, fibromyalgia. What is RSD?
Well, it's a reflex sympathetic dystrophy. Usually is caused by some sort of an injury that stretch the ligaments and the tendons, and they treat that one locally, but very often it's associated with some back problem. And if you don't treat the back problem, you don't correct the symptoms.
I have to ask, everybody wants to know about recovery after back surgery like this. What's it like after the Bonati procedure?
The beauty of this procedure is being the patient awake and being the patient who tells you all the pain is gone, the recovery is right there.
Right.
So the only thing that you need to do now is move and act normal. If you're not walking for a month, well, start to walk.
Right. Get up and start moving again.
Correct.
Well, I'm sure you've made a lot of people very happy, Dr. Bonati. For more information, you can go to bonati.com or call them at 1-855-267-0482. Dr. Alfred Bonati, thanks again for coming in.
You're very welcome.
We'll be right back.